So what we're going to do here in just a second, I've brought some experts from the Singer River Hospital system, and I'll introduce them as we go along. And both of them have been intimately involved in the overall management and care for many patients that have unfortunately had to go through experiences that required hospitalization with this COVID virus over the last year. And you know, some of the stories are quite sad, and it's not just older patients with a lot of issues, they're younger patients that they've had to take care of. Friends and neighbors, they've been engaged in this community for decades, both of them. And so, again, it just, to me, leads to the urgency of us trying to again, chip away at whatever's blocking folks from getting a layer of protection. When I got mine, it was I felt relieved that I had the injections, and now I had another layer. Now, there's no guarantees, okay? It's nothing that's been recommended that gives everybody 100% protection, even these vaccines. But each layer helps improve your defense and your protection, which in turn improves your family's defense and protection, which in turn improves the community's protection. And we've been so much, people debating what the experts have been telling us and whether that's accurate. And so we haven't had everybody kind of moving in the same direction over this past year. And hopefully we can get people with the basic recommendations moving in the right direction, and now getting folks more comfortable with this vaccine. Now, it's been around for several months now, and we're pushing up on 50 million people in this country that have gotten it. And you haven't heard, you may have heard somebody got aches and pains and fever and headaches, but you hadn't heard anybody dying, although we got 500,000 people that have died from that virus. Worldwide is over 100, almost 150 million people have been vaccinated. So yes, there's apprehension and fear, but so far the statistics are telling us that there's not any major issues so far with this. Now, we don't know long term. Yes, that's a question, but we got to deal with now. And I think that's the whole purpose of this. And I'm going to introduce Dr. Randy Roth. And Dr. Randy Roth has been a friend of mine since I've been down here. I came out here in 2003 to join the practice. And he's been just in a leadership position, not only medically at the hospital, but administratively for a long time. Completely committed to this community in many different ways, committed to the hospital in many different ways. He is the director of what we call the IPS service, which is kind of the hospitalist, internist service that works the hospital. All three hospitals now, because Singer River and Ocean Springs now part of a third hospital, which used to be Garden Park in Gulfport. So that's now Singer River Hospital, Gulfport. So, and really, when this thing hit last March, it was almost like, maybe a bad analogy, but like a 9/11 thing. And he's been like one of the firemen going in, trying to deal with this, despite his ups and downs. And he'll tell you, he's told me several times, it's almost worn him out because of just sometimes you get such a flux of patients with this COVID coming in and a lot of serious care. But the frontliners have been battling it, along with Dr. Ekenna, have been battling this thing for a year. I guess in my specialty, I'm not right on the front lines with it, so I haven't been hit with it like that as far as directly taking care of patients. But he's got a lot of perspective on this, not only taking care of the patients, but also with the vaccines and how we get them from the state, how they're distributed in this state, and how you get access to them. And so I'm going to introduce Dr. Roth to come up and kind of expand on that.
Thanks for having me. When this all started up, nobody knew what to expect. It was a disease we had never studied, we had no data on it, and we were thrown into the fire. was March 22nd or 23rd, we had our first case in Jackson County. At that point, I decided if I didn't go on the front line and lead, that I had failed my community. Just like Jesus, God sent Jesus, his only son, to live with us and to walk the walk. I'm not going to tell my doctors, go take care of these patients, and I'm going to stay behind my desk. So I rolled my sleeves up, and we took care of these people. The most horrendous thing about this disease is the isolation. These people are in the hospital. We limit visitors, if any. A lot of them are older and may not have access to FaceTime and technology. And that has taken its toll on me, because a lot of times, probably over 150 times, the last person that these folks saw before they died was me. Probably should have been their wife or their husband or their daughter. But to this audience, I can tell you the beauty of that is I believe. And I was there to be with them and pray with them and hold their hand and assure them, because we all sat down as a leadership team and said, we're going to make two promises to all these patients. They're not going to suffer at the end of life, and they're not going to die alone. And we fulfilled that mission to this day. Our nurses, our frontline people have done a great job with that. So since all this started, we all prayed together about an answer. And it reminds me of a story I was told in high school. I'm Catholic. I grew up in New Orleans. I went to an all-boys Catholic school. And I remember hearing the story that there was a cruise ship with a lot of nuns in the Mississippi River. And a tugboat hit it, and the cruise ship sank. And 3 nuns jumped on a lifeboat, and they're floating in the middle of the Mississippi River. And the Coast Guard came by to save them. And the Sister X says, don't worry, the Lord's going to save them. And about 12 hours later, the second tugboat captain from the Coast Guard came by and said, Sister, we're here to save you. High tide's coming. Her response was, the Lord's going to save me. Well, a storm hits, and the boat sinks, and the 2 sisters die, and they go to heaven. And they get in front of Jesus, and they say, Jesus, thank you for saving me, but I prayed and I prayed and I prayed that you were going to get me out of the river. And I died. And he said, I sent 2 boats to pick you up, and you ignored it. That's what this vaccine is to me. We have prayed for something, because most of the medicines are very minuscule in their benefit. They help some, but very small. And I'm not here to say anything about politics. This vaccine was politicized by both sides. Put that to the side. It's safe, and it was well studied. I will tell you, I apologize, because I'm lily white Caucasian. I apologize for what's happened in our country the last 250 years. There's history about vaccines that I'm embarrassed about, and I'm going to own it. I understand when somebody comes to me who's 84 years old and says, what about syphilis? So I'm going to put that out there. I understand that. I'm here to assure you that didn't happen in 2020. What President Trump did with warp speed put this vaccine in just big time production. 130,000 people in these 3 studies. 130,000. With, if you're compliant, about a 93% efficacy, with minimal of any side effects. What I've heard, it's an mRNA virus, so my DNA is going to get impacted and the government can track me. Not true. It attacks the M protein spike in your blood. It's not going to dig in your DNA. It's not a homing device. It's not a GPS machine. You cannot get COVID by taking the vaccine. This is not a live attenuated virus. You cannot get it. The second vaccine, you may be a little bit sore than you are on the first vaccine. There has been 1 death, an anaphylaxis of a doctor in Chicago who anaphylaxed with the previous allergy, and that was the only death that I've heard of. We have given about 17,000 Singing River, minimal, no admissions to the hospital. They're sore around the site, maybe a rash. So my message tonight is this virus preys on what we call vulnerable people. It's not a racist virus. It wasn't made to knock out a certain set of people. But if a large subset of African American and Hispanics, and in Mississippi in general, it's the most obese, heaviest smoking state in the country. That's who gets this disease. And that's what we've seen take a lot of the lives. But to Dr. Washington's point, I've had an 18-year-old volleyball track athlete from a local high school that died with no comorbids from COVID. I've had several people that are very young that die of this, and I don't know why they died. The vaccine's not racist either. We have prayed for this vaccine for months, and now it's here. And the compliance rate is shocking to me. And that crosses all lines. Our medical staff, 92% of the doctors have taken the vaccine. That's still pretty shocking. That 8% of people that went to medical school and are on our medical staff are not taking the vaccine. That's one statistic. Of our employees, only 49% have taken the vaccine as of today. That can be a little misleading because a lot of our employees are childbearing age women who there's not great studies on whether or not it can go through the placenta if they're pregnant and getting antibodies and breast milk. And I can almost maybe rationalize those. But you look at the statistics in the minority patient populations, and it's under 20. And when you talk to the people, it is, I think, two things. Distrust. I've been burned once. And number two, access. How do I get access? Do I have a cell phone? Can I get on FaceTime? Do I know what FaceTime is? Do I know what an iPhone is? So one of my messages to you, the pastors, who are leaders in our community, that's one thing. We do a lot of great things in Mississippi. And honor the Lord is number one. I don't know if you know this stat, but you realize that per capita, Mississippi is the most generous state in tithing the church in the United States, per capita. They give a highest percentage of their income than any other state in the union. So you're in front of your congregation, they trust you. They trust you. So my message is, this vaccine is being allotted by the state. And we're giving the vaccine based on how much the state releases to us. I can't predict when we're going to get the next 1,000 vaccines. And the only way that we can get it out there fairly is to post it and put it in social media or on the news. Right now we're doing events on 2 of our campuses in Gulfport and our campus at Pascagoula on the fairgrounds. Our website, if you're website savvy, we have all those questions frequently asked are all on our website. Utilize that. I get asked all the time, what kind of protection will this give me? Will it work against the variants? We think that some of the variants this vaccine will cover. The duration, we don't know. The studies are going to go up for 4 years. So we don't know whether you'll take this every year like the influenza vaccine or every 18 or 24 months, but we'll know that pretty soon. But for now, all I can advocate for is taking it. There are very few, if any, contraindications. If you have active leukemia in your bone marrow transplant, the answer to that is no. If you've had an anaphylactic reaction to a previous vaccine, I want to talk about that. If you've gotten the BAM treatment, which is the monoclonal antibody, you have to wait 90 days because you're hypersensitive to that. You're going to get asked that question. Other than that, I've been in all these drives, I get asked the same question. I'm allergic to penicillin. It doesn't matter. My mom had an anaphylactic reaction when she ate crawfish. Not a contraindication. You can still get it. The other thing I want to put out there is the health department's doing this too. So please, advocate for the health department. They're not as efficient as we are, but they're doing a pretty good job. They have a questionnaire and it asks them if you've had an allergic reaction at all. And if you say yes, they're not going to give you the vaccine. And that's because of the risk aversion. They don't want to put themselves at risk. Those people are automatically sent to us. And we'll get the vaccine for you. I can tell you after being on the front line for this for 9 months, this is one of the things that we've prayed for together. We've prayed for a vaccine, and we've prayed for empathy and compassion. So I'm here to tell you that we will work with your faith community to get them access to this vaccine. But you got to talk to us. You got to let us know what we can do for you. You know, I will come and speak in front of any group that wants to listen to this old guy from New Orleans. I am passionate about this because of the amount of death and morbidity that I've seen. We have families in our community that have lost 5 and 6 relatives. I know a husband, wife, team, and a son from one family who all died within 2 months of each other. And it wasn't because they were on a cruise ship, and it wasn't because they went to a casino. It was because they did what we all love to do, which is be together. But they were together a little recklessly. So the amount of pain that I've seen, this is a glimmer of sunshine. So my ask of y'all is, from the pulpit, I will tell you, I'm happy to come, but you guys have much more influence than me.
So listen, this was just kind of put together as an initial step, and of course I've talked to others, and people have been doing things to not only educate their congregation, because I mean the churches have been affected big time during this past year because of the pandemic and inability to congregate and so forth in the churches. So again, the whole push is to, number one, just kind of give you information on logistics of the vaccine and information on the vaccine, and to continue to try to, I mean, everybody that's contacted me, family, friends, I just tell them, listen to the experts, get off the internet, and as soon as you can get in line and get your vaccine, get your vaccine. Because right now there's nothing saying that there's a big risk factor. Yeah, there are unanswered questions as far as how long it's going to protect you, what are the long-term effects. But we are dealing with some short-term effects right now that they can be quite consequential. And you can't come back from death. And right now, to me, your gamble is, potentially getting exposed and such a wide range of how that's going to affect an individual person, from sniffles and loss of taste and smell to intubation and death. And I'm not willing to take that risk over potential risk of a vaccine that's gone through a process. And I've always felt like when it first came out, people asked me, they said, well, as much havoc as this virus has wreaked on this country and this world over the past year, when they came out with this vaccine and approved it, they knew they had one good chance to try to make this thing happen. And I don't think they were going to put something out that after a couple of months was going to flop, because that was going to interfere with vaccines going forward across the country. And so I felt quite comfortable, not only that the experts said that it was safe, but the fact that just logically, they're not going to put something out after all the havoc that's been wreaked on this country that's shaky. Because if it's shaky, we're going to find out sooner or later. And then when we find out, it's going to make it a lot more difficult to sell the next vaccine around. So our purpose is to encourage our community, which is part of a bigger community, to hopefully be more comfortable. We're not going to get everyone, and we don't necessarily need everyone to at least get some general protection and get back to some normal lifestyles. As Dr. Ekenna said, 75-80% gives us that, quote, herd immunity, and it's just going to be some people you're just never going to convince for various reasons about the vaccine. But the clergy, pastors, have a trusted voice, always have had. And I think and you may not all be convinced, but if you are, and you can spread that to your congregation, which is, if you get a few in your congregation, well, they got family, they got friends, they got co-workers, so it's a network. If you get one person convinced, they get it and they do okay, it's a network. And I think as a community, we've got to improve both, acceptance and access. And that's what this whole thing was about, bringing the hospital together to say, how do we get access? Doesn't mean you can move to the front of the line. But as you said, other vaccines are going to be coming out. And so we got to start preparing our community so when it's available, hopefully we get more people to be accepting of it and getting it done. And doing so, it improves the layer of protection for everyone. And it's not just the minority communities, but the majority communities. And we can all hopefully in the near future start getting back to a more normal lives across the board. So that was the crust of what we wanted to do tonight.